I can try to link it in again. Thanks for introducing yourselves. We are the Child Outcomes Accountability Team, and we meet every other month. And we are a committee of Vermont's Early Childhood Strategic Plan, also known as the VCAP, often focused on Goal 1, which is all children have a healthy start. And since our last meeting in January, a lot has changed. There's been a lot of changes at the state and the federal level. And we wanted to use this time today to build off of a conversation in the forum that happened at the State Advisory Council meeting in February. This was an opportunity for folks on the State Advisory Council and other community partners to really have a discussion about the impacts of federal in particular, but also state changes on the impacts of young children and families. And the topic of public benefits came up quite a bit. There was a lot of concern about changes and questions about, how much federal funding is supporting these programs. What should we be worried about if that money goes away? So we wanted to build off of that discussion and make sure that we gave time to focus on, hear from experts that know a little bit about the current status of these programs, in particular Medicaid and SNAP benefits. Here comes Ashley. And we invited folks here, Ashley and Ivy in particular today, to give us a status update on these programs, any changes that may have already gone into effect, and how much these programs are reliant on federal dollars versus state dollars. And then I'm hoping we can have a discussion together about, what we're seeing, how this is affecting children and families already, and then maybe how we can be prepared as folks in the early childhood system to use this knowledge and be prepared and be as responsive as we can be over the next few months or year. So I think, and I also want to say that, we're talking about Medicaid and SNAP in particular today, and we reached out to some folks who focus on Reach Up, and they weren't able to join us today, but we also have a lot of experts in the room, and there are a lot of other important programs that fall under the sort of wide umbrella of basic needs. So after we hear from our Medicaid and SNAP folks, we can open the floor up and share what we know or ask questions, related to child tax credits, Head Start. If there are folks from the Reach Up, who know more about Reach Up here, we can share. So with that, I will turn it over to Ashley, if you're ready. Ashley, are you here? Yes. Ashley Berliner is the Director of Medicaid Policy at the Agency of Human Services. And then after Ashley, we'll turn it over to Ivy Enoch. Ivy, am I pronouncing your name correctly? From Hunger Free Vermont. Awesome. Go ahead, Ashley. Thanks for being here.
Yeah, I'm sorry. I was having some computer issues. Is this just introductions right now?
We've had folks introduce each other in the chat. So if you're ready to dive in and share, we're ready for you.
Okay. Hi, I am the Director of Medicaid Policy for the state of Vermont. I work at the Agency of Human Services, and I have been having lots of conversations since January about how the federal conversations might impact the state of Vermont. And unfortunately, they are not fun conversations. Anyone who's following the news knows that Medicaid is a big target for Congress right now in terms of finding savings. We are in a little bit of a limbo right now because the reconciliation bill is not set to really have be picked up and be understood to be a kind of a final product until May at the earliest. More likely June or July is when we'll see something coming out of reconciliation. So right now what we have are just a lot of scary ideas, and they're very scary. The things that we are hearing about the most are what I'll talk about today. There is a whole laundry list that congressional Republicans have put out in order to identify Medicaid savings. However, they're really focused on about 4 proposals right now, all of which are pretty detrimental to Medicaid programs across the country. So I'll start with the first one, which is this idea of per capita caps. Right now, Medicaid is an entitlement program, which means that regardless of how many people are on Medicaid and regardless of how many services they utilize, the federal government has to pay the bill. What Congress wants to do is put a cap on the number of services that an individual can receive. So not at an individual level, at an aggregate level, but they are talking about these per capita caps, which would break out Medicaid by eligibility group and say that you have this amount of money to spend in the new adult group, or this amount of money to spend for children, or this amount of money to spend for pregnant women. Unsurprisingly, we do not expect these caps to be generous. The idea is that they will save money. And initial projections right now are looking at, for the state of Vermont, about $1 billion over 10 years in lost federal revenue as a result of per capita caps. That is based on not much, because we don't have a ton of detail, but it is based on what the Congressional Budget Office is using for savings. It's based on historical spend and what we project trends will be built into those per capita caps. So that in and of itself is a big hit if it happens. Embedded within per capita caps, they are very recently, as of this week, starting to talk about how the new adult group, which is what, when people talk about Medicaid expansion, they're talking about the new adult group under the Affordable Care Act. Previous to this week, they had been saying they just want to eliminate the enhanced federal financial participation that states get for the new adult group. Now they're saying we're actually just going to make that per capita cap for new adults really, really low to disincentivize states. And again, everything around these Medicaid program cuts, the proposals that we're hearing right now, are focused on savings, which translates to less coverage, less services. Are we taking questions now, or should I just kind of get through it, Kate?
If you're game to take questions as we go, I'm good with that. Does anyone have any questions?
Yeah, just speak up if you have questions, otherwise I'll keep rolling here. So really cheerful topic. The next one.
I think there's a question, Ashley.
Okay, go ahead, please.
Yeah, so I have a question. Do we have any updates on what's happening with AHEAD or with the CCBHC funding?
Yes, we do.
Okay.
AHEAD, so CMMI, the Centers for Medicare and Medicaid Innovation, is what puts forth these payment reform models. And AHEAD was listed as a model that they would continue. However, Vermont just renegotiated, or just, sorry, not renegotiated. We just negotiated an AHEAD agreement in January under the Biden administration that would take effect in 2027. And it had some pretty favorable terms for the state of Vermont. When the feds just recently announced that they would be continuing AHEAD, they essentially said that they would have to renegotiate with states, and that some of the things that we got in January will no longer be on the table under this renegotiation. So right now we're still slated to start in 2027, but we do have to renegotiate. Time will tell whether or not it's a favorable agreement for us and something that we want to continue to participate in. But certainly it won't be as favorable as we originally thought it would. And so there's some calculus that needs to be done to understand whether the juice is worth the squeeze, so to speak. AHEAD is a payment model. It is a multi-payer model through the Centers for Medicare and Medicaid Innovation, and that it essentially will replace our Vermont all-payer model, which is through OneCare right now. It is a model that brings in Medicare dollars into the state. And AHEAD is not Medicaid, to be clear, so I am not the best person to speak to it. But the idea is that we can leverage the massive Medicare dollars that come into Vermont and steer them in ways that benefit Vermont's population. So a big component of AHEAD is global hospital budgets and paying hospitals not in a fee-for-service way, but in this global budget way, which would be an evolution on how we've been doing it with OneCare. And that is about all I can say about AHEAD, so no questions there, please.
Thanks, Ashley.
Okay. So per capita caps, big hit, $1 billion over 10 years is our initial projection. The next thing that we're hearing a lot about right now is this idea of provider taxes. Every state in the country puts provider taxes on claims from certain provider groups. It's a huge way to generate revenue for state general funds and Medicaid programs. And we are hearing initial proposals cutting our ability to raise provider taxes in half. There's a 6% threshold on net patient income right now on provider taxes. Proposals that we're seeing bring that down to 3%. This is super wonky, and I think it's by design because it's unlikely that the public is going to get really worked up about the idea that provider taxes are getting cut in half. It's a concept that you really have to understand to get at why it's so detrimental, which I think is going to be something that is in congressional Republicans' favor as they push some of these Medicaid cuts forward. It's not eliminating services. It's not reducing eligibility. But what it does do is significantly cut state budgets for Medicaid. So instead of the federal government coming in and saying, cut eligibility for kids or don't pay for these services, they're just going to reduce our federal revenue by a whole lot of money and force states to make those really hard decisions. So this is like a particularly pernicious proposal, in my opinion, that makes states the bad guys and is kind of hidden in this really weedy, wonky policy construct. So in Vermont, what it would mean to cut provider taxes by half is a loss of $220 million a year in federal revenue. Our Medicaid program yearly is about $2 billion. So 220 million is a huge chunk of that. And we really wouldn't have the money to backfill these sorts of cuts. There's no kind of making it up in general fund. Okay. There is also a
Ashley,
formula. Yep.
I'm sorry, Ashley. Sorry. Why do you say there's no way to make up that loss in the general fund? I mean, would it not be possible for the state to put some alternative tax structure in place? I'm not saying it's easy or quick or simple, but is there no way to replace that revenue?
Well, of course, you could raise taxes in other places. Sorry, you can absolutely raise revenue elsewhere. This revenue is, people often refer to it as a hold harmless tax because the money gets refunneled into provider reimbursement rates through the Medicaid program. And so any making it up in state revenue would not be held harmless. It would be an actual tax, and it's a huge amount of money. So it would be a lot to make up. But absolutely, that's always going to be an option, is raising taxes on Vermonters.
But if you did the same tax and used it for the same purpose, but it was just the state doing it instead of the federal government, why wouldn't it
It
just
is
be
the
the same
state
thing?
doing it. It is the state doing it now. It's the
Okay.
state doing it now. So the way it works is we raise the revenue and then we match it with the federal government. That's how we get the money. It serves as our state share. Every Medicaid dollar has to be matched, or sorry, every federal dollar has to be matched by a state dollar. And so what the provider tax does is it raises the state dollar to be able to pull down those federal funds. So if we don't have that, we can't pull down the funds. Yes, we can raise taxes through something else, but that's going to not be a hold harmless tax. It would be a significant tax increase to generate that kind of funding. So another kind of wonky financing thing with Vermont Medicaid is something called the FMAP rate, which is FMAP stands for Federal Medicaid Annual Percentage. And it is a formula that is built on per capita income in a state, certain benefits that individuals receive in a state, and it changes every year. We normally think of Vermont's FMAP rate as around 55% federal dollars, 45% state dollars. Right now, and that fluctuates year to year. Right now, we're really more at 58% federal, 42% state. The congressional Republicans right now are talking about changing that FMAP formula so that the financial share is lower than that 58% right now, 55% more generally. So that would be obviously a hit to our budget in the area of $18 million per FMAP point. So if they are reducing FMAP from 58% to 57%, that's a loss of $18 million for the state just on that 1%. So you can imagine if that FMAP formula changes significantly, those percentage points can add up to quite a bit of money. Okay. And then the last piece I'll say in terms of what we're hearing really getting some traction in Washington right now is this idea of work requirements. Requirements are a really popular idea in certain circles, and they're certainly not new to social benefits and programs nationally, but it is a brand new idea for Medicaid in particular. Medicaid, as I said, is an entitlement, and so work requirements are not allowed per federal law. There is conversation, and we very much think this will happen, that work requirements will be imposed in order to receive Medicaid in the future. And we don't know exactly what that looks like, which populations will be carved out of work requirements. Certainly, we expect to see people with disabilities, aged, and children to be carved out. We also don't know what certain school statuses will do for work requirements. If you can be a part-time student, if you can be a full-time student, if being a parent gets you out of work requirements. This is all the level of detail that we expect to see either in legislation or regulation that will tell states how much discretion they have on imposing these work requirements. Work requirements are a policy that is aimed at cutting people off of Medicaid rolls. That's why savings are generated from putting them in place. The idea is that work requirements will make it harder for people to get on Medicaid, and then Medicaid will spend less money. In Vermont, and I think in many places across the country, work requirements also come with really significant IT costs associated with actually programming the verification. So how do you prove that someone is working? How often do you have to look? What data do you need to be able to prove that? And then, of course, additional staffing would be needed to also verify that information, get the paperwork, talk to individuals about what was needed to verify income and work. We also expect there to be significant churn associated with this policy, which means people will be coming in and out of Medicaid, in and out of Blue Cross, in and out of Medicare, not Medicare, in and out of Cigna. So that in and of itself, that churn creates a lot of administrative costs and confusion for providers, for payers, and certainly for beneficiaries. So those are the areas that we're really focused on in terms of having significant impact for the state of Vermont. We think they're likely, some flavor of those are likely to come out of reconciliation this summer. Paying really close attention to what's moving. We're talking to lots of states about this, trading information. We're in touch with our congressional delegation. And we're also looking internally to understand what's mandatory, what's optional. If cuts like this came down, what would hurt the least? How do we mitigate the worst of this impact? The 4 levers we have to deal with cuts of this nature are making it up with state general fund. So either other programmatic cuts or increased revenue. Cutting provider rates, making Medicaid reimbursement rates lower to make up for it, cutting services, or cutting eligibility. So surely if we're looking at a magnitude of this size with all of these combined, it's coming out to be about $500 million a year in lost federal revenue if everything came through. That's 25% of our Medicaid program. We would need to do some combination of all 4 of those things. And there's not really any sugarcoating any of this. This is scary stuff. They're big cuts. They will have really detrimental impact on our system of care. So I think with that, I will stop. And apologies for the doom.
Thanks, Ashley. I think, there's power in being informed and not being caught off guard. So even though it's not easy information to hear, I think it's really important. So thank you. Let's move on to Ivy now, and then we can ask more questions and talk more about this together. So Ivy,
Thanks.
Ivy is our SNAP policy and training lead at Hunger Free Vermont.
Thank you so much. And unfortunately, I will just continue riding the doom train. So just apologies in advance. But just to make sure we're all, a refresh on SNAP in Vermont. It's known as 3 Scores Vermont. And what it does is it gives people who qualify funds every month on an EBT card to buy groceries. And folks can do that at more than 700 retailers in Vermont online, but also anywhere in the US that accepts SNAP. Currently in Vermont, about 10% of our population receive monthly 3 Scores Vermont benefits. That said, we know many, many more Vermonters qualify based on census income data. However, 3 Scores Vermont does effectively reach our most low-income families in Vermont. But not everyone who could benefit from the program is currently benefiting for a lot of reasons: stigma, shame, which are very real reasons, a complex application process, but also misconceptions about who is actually eligible for the program. In Vermont, about 1/3 of our total 3 Scores Vermont caseload are children under 18. And so 3 Scores Vermont is a really significant boost to food budgets for parents or for folks caring for children. And just to put that into perspective, the average monthly benefit for families or folks with kids in December 2024 was about $550 a month. So it's significant money going into folks' grocery budgets. In terms of the funding for benefits, 100% of the monthly SNAP benefits are federally funded for every state. That has always been the structure of SNAP. The administering costs of SNAP are a split 50-50 cost share between a state and the federal government. In terms of changes to SNAP that have taken effect with the new federal administration, None have occurred yet. So SNAP continues to operate business as usual for participants, but that will, unfortunately, that will change this year through Congress's budget reconciliation, as Ashley talked about. And so we are anticipating a lot coming down the pipeline for SNAP. I would say Medicaid and SNAP are the two programs with, the largest targets kind of facing them. So the House budget resolution, which was passed in February, is basically mandating the Agriculture Committee to find $230 billion in cuts. That's over 10 years. And they're primarily looking to find those cuts under, Department of Agriculture in SNAP. And just to remind us all that that is all in order to fund tax breaks for the wealthy. So taking grocery benefits away from low-income Americans and Vermonters for tax breaks is basically what congressional Republicans are seeking to do. And there's no way to make such deep cuts to SNAP without harming every single participant on the program. And so what we're hearing, there are no official, they're going to do this, they're going to do that at this point, because as Ashley said, reconciliation, we are still a long way off from that. We're hearing that there are really three options for achieving cuts of that magnitude. And the first is to roll back the 2021 revision of the Thrifty Food Plan that the USDA did. And the Thrifty Food Plan is basically the formula used to calculate monthly SNAP benefits. And so rolling back that update to the program, which essentially brought SNAP benefits into the modern era of our country based on the real cost of groceries and the amount of time people have to prepare food. Rolling that back would cut every single SNAP participant's benefits. The second proposal is to expand existing SNAP work rules that are already really deeply harmful. And though SNAP is an entitlement program, SNAP work rules are allowed. And right now there are two different SNAP work rules that folks have to either be exempt from or report monthly work activity, or they will lose their benefits. Typically, the folks who have to meet a work requirement now are people between the ages of 18 and 54 who are quote unquote able-bodied without children. And so what congressional Republicans are looking to do is to essentially just expand who has to report work activity. And they're looking at older adults up to 65, parents with kids 7 and older, veterans, homeless folks, and more, which, as Ashley said, the goal behind that is to restrict eligibility. People will fall off the program, though they will lose their benefits if they're not able to report work activity. And then the third provision, which from our perspective and many advocates' perspectives is the most concerning and most harmful, is for states to pay for a percentage of the monthly SNAP benefits, which, as I said, currently 100% federally funded. So this is a totally unprecedented idea. And like I said, all of these options on the table would be really devastating to folks who depend on SNAP. But the third option in particular, that state cost share, legitimately threatens the existence of SNAP. That's not dramatic. And it's also just a deeply troubling prospect for state budgets. And to paint the picture, we don't have a sense of what that percentage would be, but some projected costs to Vermont state budget ranges, again, depending on what the percentage of the state cost share would be. So if we had a 5% state cost share, that would cost the state $7 million annually. If there were a 25% cost share, that would cost the state $37 million annually. And where it gets complicated is really thinking about how this would hit states twice. So that would be, money that the state would have to match, but it also, we have to take into consideration the federal dollars that would not be coming back into our state economy by states having to match that. So those numbers, think of them as doubling. That would be the hit to the state budget. SNAP in its current form has always been an entitlement program, and I think Ashley did a really good job of describing, what that is. Everyone who qualifies is entitled to receive those benefits, and the federal government has to foot the bill. But a state federal cost share would really undermine this foundational element, because many states, including Vermont, would be hard pressed to actually make good on that cost share for no fault of their own. So it's congressional Republicans considering it an unfunded mandate. Basically, they don't want to make the cuts, and footing the bill, forcing the states to foot the bill is essentially requiring states to make those cuts. So if states couldn't match some percentage, that would basically mean there would be, for the first time ever, a cap in effect on who could actually participate and receive SNAP benefits. I did also just want to highlight a little bit more about the work rules. It is a really detrimental prospect. Work rules right now are really harmful to Vermonters, but it would be especially harmful, I think, right now for people with kids, because currently, under current rules, households don't need to meet the work requirement if they have children in the household. So requiring people with kids 7 or older in their household to meet an additional eligibility requirement, I mean, it will be really confusing, it will be really upsetting, and it will ultimately lead to people losing grocery benefits they depend on. So that is really what we're contending with in terms of how best we can be, prepared and responsive to the changes. I would say, there are a lot of conversations right now, between advocates, congressional delegation, to identify of these 3 really, really terrible options, which would be the least harmful to people. And it's more of a wait and see. But there are things we can be doing now. I would say, Hunger Free Vermont is in really close contact, both with ESD here in Vermont, but also with the congressional delegation. And we're hearing a couple of, messages, basically what can we all do right now. And this may sound simple, but I would just say, firstly, it's so important for all of us to continue sharing the message that SNAP is a critically important program that still works right now for tens of thousands of Vermonters. It's a program that we really need for Vermonters, and we all need to, be really vocal about that and make sure folks who have SNAP right now, or folks who could qualify for SNAP right now, are tapping into the program because it is operating as it needs to right now. And also, making sure folks in your networks have accurate information about the program, how it's operating right now, that it's still worth it to tap into those benefits is really important, just to mitigate the spread of misinformation and fear, though the fear, unfortunately, is very legitimate. And secondly, what we're hearing from our congressional delegation is that stories really, really do matter. We just talked with them on Monday about all of these potential cuts and went into a lot of detail about what it would look like for Vermont if any one of these 3 things happened. And so they're taking it very seriously. They're very informed about what any of these options would mean for Vermont. And hearing from individuals in Vermont about why SNAP matters to them, what these cuts would do to their communities, their families, themselves, how SNAP as a program supports them now, those stories are really important for our senators and congresswomen. And so calling the DC office in particular is a great and really important action to take. You know, one of the staffers from Senator Sanders' office was saying, whenever the senator comes into the office, he says, you know, what are people calling about right now? And so making that be a primary message from Vermont is really important. And if it's easier, or in addition to doing that, Hunger Free Vermont also has a brief form on our website to collect impact stories to then share with the delegation. So if a phone call isn't possible, that's another option. And any of these actions are really valuable right now. And I know there are advocates stateside who are talking in coalition about, you know, what are the state options. You know, revenue generation is on the table. But I'll leave it there for now. And I think I saw a question in the chat.
Yeah, thanks, Ivy.
Sorry,
That's
can I just ask my question, Kate? Is that okay?
yeah, go ahead.
And it's purely to Ivy and Ashley, I guess, and I worded it better the second time, but essentially in all of this description, we're not hearing narrative that the federal taxes will be lowered. So the federal tax dollars that are being paid in, what we're hearing really, or what you're basically all saying is less of those monies are going to come back into the state to fund these programs. So the state has choices, albeit challenging and really not favorable ones. But the only way to make up the loss of that money coming back to the state that the state workers are paying to the federal government is to increase what the state workers are paying into their state taxes to make up that thing, or we have to initiate and we'll still have to initiate cuts because there's raising that revenue in state income taxes or other state level taxes. It would be quite burdensome to the state workers. Is that what I'm understanding?
Yes. Yeah, exactly.
Okay, thanks.
So one thing I'm hearing, and Ashley and Ivy, correct me if I'm wrong, but it sounds like we are expecting these challenges to take place in a few months from now. So one thing to do right now is to continue to help folks to apply and still utilize the programs, both SNAP and Medicaid, that we have available, and, you know, not encouraging folks to have mass exodus, but to stay the course, keep applying, keep using those benefits. So just wanted to reiterate that. Matt, go ahead.
Thanks. A comment and a question. In terms of taxes, I think, as Sarah pointed out in the chat, the question of tax policy and how that's all going to work out is rather complicated. And Danielle, I think my direct response to your comment is that the tax breaks that are being contemplated here has been commented for the federal tax breaks being contemplated are for very wealthy folks. And there's a whole question about tax policy in the state and what the capacity is to generate revenue and who could be taxed and so on. So there's a possibility that the state could increase taxes on wealthy Vermonters and those who are making very high incomes, who many of us argue have not been taxed at a rate that has kept pace with inflation and the income gap, wage gap, et cetera. So, I mean, there's a whole interesting area of tax policy. So you had said that the only way to raise the revenue was to tax workers. I think that's not the only framing. There are other frames that could be used to contemplate revenue raising. So that's not the subject of this meeting. But I just want to comment on that and put that aside. Ivy, I'm wondering if you could repeat something that I just missed. I think it was your second point in your list. At one point you said, so this would be a double impact, that I lost what the doubling was. Could you go over that one more time briefly and help me understand what it is that would impact us twice or double? I think you know what I'm referring to since you're nodding.
Yes. Yes. So what I'm saying is if states had to, for the first time ever, pay into SNAP benefits, you know, that would be money from the state budget going to pay for benefits. And that would be, you know, for example, if we had a 25% cost share, be $37 million that the state would have to pay into But when we think about how that would hit the state twice right now, because 100% of benefits are federally funded, you can consider, Vermonters paying, federal taxes, and we, in a sense, get those taxes back through federal SNAP benefits. And so then if we had to pay 25% of that and we weren't getting 25, very simple, I'm speaking kind of broad brushstrokes. If we didn't get that back in federal taxes, you can look at it as a double hit to our state because, SNAP is a really effective economic stimulus program. People are using their benefits at grocery stores, farmers markets, whatever. It's, imbuing our state economy with federal dollars. And we would lose that.
So, right. So I think there are two different points you're making as I hear it. One is that if we wanted to replace it, we'd both lose it and have to pay for it. So in a sense, that's sort of twice if you square that in a way.
Yeah.
But you also just raised another issue, which is that a lot of these federal programs have a multiplier effect in that the money gets spent directly into the local economy, which means that the tax dollars that are taken out of the state, sent off to Washington, D.C., come back in the form of benefits, go back into the system because people are spending that money locally. So that's a different question that is an additional multiplier effect that we would lose if these programs are reduced in their spending. Okay, thank you very much. That's much clearer.
Yeah, thanks, Matt.
Katie, go ahead.
I have a question. I don't know if this can be answered here, but I was curious about how the Medicaid proposed cuts translate into Title V funding and some of those kinds of funding. How do those intersect?
Was I able to come off of mute?
Yep, we hear you.
Okay, my whole screen is like every window just opened all at once, so I can't see anyone. I'm really sorry, as I told Kate when she asked me to do this panel, I am not as familiar with the children's world. So can you tell me what Title V is?
I may not be the best person to describe this, so anybody else jump in. But my understanding is Title V is a block grant for maternal child health services. And so I just don't understand if it just gets reduced if we have overall revenue or if it's like separate in some other. So is that enough to say it's a block grant, or do you need more information?
So what I can say is that the Medicaid cuts that I'm talking about are Medicaid specific, so they wouldn't impact anything to do with other block grants, SAMHSA block grants, if there's a maternal child block
This is
grant.
a Medicaid block grant. It's like Medicaid funding.
Okay, I will have to look into that because I don't have any familiarity with that. And I know, yeah, I'll have to understand that better. It's certainly not part of our 1115 waiver, which is the entirety of our Medicaid program in the state of Vermont. So let me look into that.
Thank you.
I think, yeah, and it seems like so there's impact to direct individuals who have the entitlement benefit. They have the Medicaid, the Green Mountain Care card, or you have the SNAP card that you use at the grocery store, and then there are these programs that, like I'm thinking for SNAP, there's our food shelves and the food bank, and then for Medicaid, there's these block grants that are funding. There's school Medicaid dollars and programs for child maternal health. So I'm wondering, maybe Ashley and Ivy, you have something to say about what about those programmatic changes? Are those being targeted in the same way as the individual entitlement programs?
So I want to understand more about this Title V block grant because I am pretty intimately familiar with Medicaid funding as it relates to Vermont spending, and that like any sort of block grant is not on my radar at all. So I feel like I just want to make sure we're using the same language. As far as school goes, also not a block grant, part of Medicaid funding. We're not hearing any specific directives come out of the feds. They seem to have the position that they're going to cut revenue to states and states have to make the hard decisions. It's in the state's hands. So when we're looking at a 25% cut potentially to the Medicaid program's federal funding, will that trickle down to school-based services? Perhaps. Will it trickle down to literally everything? Perhaps. I think it's really hard to have this conversation right now, given the breadth of cuts that we're talking about, because I don't think that much can be spared if worse comes to worse. How things play out, there are going to be lots of conversations in the state house about that. There are certainly going to be conversations about what's mandatory and what's optional. School-based services are a mandatory service. So that's certainly not one that's going to get cut just as a service category versus, let's say, dental is an optional service. That's something that down the road, maybe we have to cut because we don't have enough revenue for that. Thank you for sending that, Margaret, in the chat. I'll take a look. But those are going to be policy conversations that have to happen around the budget, how things impact individual sectors of the Medicaid program. Nothing is in, and from what we're hearing right now, nothing is going to be dictated to us, with the exception of gender affirming care.
Thanks for that, Ashley.
I can jump in on the food bank side.
Yeah,
Okay.
that'd be great.
So yeah, I will just start by saying that SNAP, for every 9 meals served by SNAP, the charitable food system is serving 1. So I think it's important to acknowledge, our charitable food system in Vermont is so important, and we need that to continue to exist right now under the current structures. And SNAP is the most effective anti-hunger program, the most effective federal nutrition program. And when we see cuts to SNAP, the impact on food banks and pantries is going to be really significant, because if folks are losing even half of those, 9 meals, are going to have to visit food pantries or food shelves maybe more than they do already. And so we know, that the food bank for years have been seeing record visitation every single month. And we also are seeing right now that, funding for TFAP, which is the federal program, basically the USDA foods program, that food banks get a lot of their food from and then distribute it across Vermont. Cuts have already occurred to TFAP in Vermont. We haven't seen that yet, but that is also under threat. So it's not a great picture all around.
Thanks. That sounds helpful. Matt, go ahead, and then I want to open the floor up for folks to share more reactions or ways that this is impacting kids and families.
Right. No,
Go ahead,
and thank you, Kate. I appreciate that. I've commented several times. I just want to note that one of the things that's actively being discussed, although very much behind the scenes in the State House right now, is what part of the state's infrastructure, governmental infrastructure, should take the lead in responding to changes that happen outside the legislative session, which is likely, given the different timing of the federal legislature and budget making as opposed to the state legislature and budget making. So the state legislature's in session now, will likely be out for the most part by the end of May, and the budget is being written now and goes into effect July 1st. The congressional calendar is very different, and so, as has been referenced, many of these decisions may be attempted to be made anyway in late summer and early fall. And so there's a very active conversation, again, not very public, but still very active, because the legislature won't be in session. So who in the state infrastructure should be responsible for responding to these things. And what I would say is, if your organization is concerned about whether the full legislature should respond to this, or the emergency board or the joint fiscal committee should respond, which are small subsets of the larger system, then you should reach out to your legislators and your champions in the state house and express your opinion. It's not a very public discussion, but it's a very active one. Or you can contact me directly or others on this tile set who are active in the state house, and we can plug you into that discussion. It's a very important question. What part of the state legislature and the state government gets to respond when the federal government makes changes when the legislature is not in session?
And I'll just say, it's a great point, Matt. We're talking internally right now about how responsive we need to be necessarily. The legislature right now is talking about potentially authorizing a special session in order to deal with some of this stuff in the fall, that some of the cuts that we would potentially have to face. There are trade-offs to being ready to react on day one, depending on how some of this shakes out. Work requirements, for example, they can impose work requirements on us, but we cannot do that on a dime. We have to change IT. We have to hire staff. We have to get budgets. We have to get money in our budget first to be able to do either one of those things. So having a special session to get the money out to us will make it happen faster. I'll say there are trade-offs to being quick to react to some of this, and we're trying to figure out exactly what things we can slow walk and what things we might have to be able to react to very, very quickly because of loss of funding.